Until one day, like I pressed on it, right? And then I was like, wow, I didn't realize that was so sensitive. Or I think I had a chiropractor friend press on it and I was a little bit surprised at how tender that is. So a lot of times you can have pain in an area and not realize it until you touch it and press and kind of dig in there a little bit, lightly, gently, okay? I'm not telling you to dig into your clavicle and your ribs, folks, okay? Hello everybody, we got a case of costochondritis, or is it? Or is it a slip rib? Or is it a shoulder problem? Well, this is gonna be a good video for you guys that are trying to figure costochondritis out. Do I have it? Do I not? Is it a slip rib or a misaligned rib or shoulder problem? So let's dive right into it right now. We have can I use your real name or do you want me to use another name?
Use my real name.
All right, Derek. So we have Derek here who traveled far. He traveled all the way from Bermuda to treat for this. And I know those of you that suffer from costochondritis, I know what you go through because I have had costochondritis and I have actually never admitted that on camera till now. I've admitted that I have hiatal hernia, and a lot of people know me for treating hiatal hernia as acid reflux. I guess that's what kind of taught me to specialize in these conditions because I've had them myself. And I know the pain that people go through, although I imagine people have way worse costochondritis pain than I've had, but I've had some pretty intense pain before. Now, I'm not gonna go into my case because that's not what this is about. This is about Derek here and all of you guys trying to figure out whether you have costochondritis or a rib problem and what would cause that rib problem. So Derek, after doing a history and looking at his back, I found a scar here on his shoulder, and he fell off of a ladder when he was 18. In construction, landed on some equipment. So, ow, that couldn't have felt great for his shoulder, but it was on his left shoulder, and his problem is the left side of the rib cage. We're gonna get into that in a second. We already did his exam, so I'm not gonna film an exam. You're gonna have to come in for an exam if you're dealing with this problem, or go to your local chiropractor that knows how to adjust the back. Of course, all chiropractors know how to do that, but the rib cage and the shoulder girdle. And there are specialists that do that. Those are called CCEPs, Certified Chiropractic Extremity Practitioners. Not all chiropractors are extremity adjusters or well-versed in it. Some don't have the certification and are very well-versed in adjusting the shoulder girdle and the ribs. So it just depends on who you go to, but we're not gonna dive into that either. So we went into his case and we found that he had that old injury and that he was doing dips, and that triggered all of his chest pain. And after doing an exam, I could feel his rib heads were out. Not only that, his clavicle felt not only tender, after I poked around, we found a tender spot, right?
Yep.
So, but he didn't really notice that. He didn't notice that his clavicle was tender. And I had the same issue for years until one day, like I pressed on it, right? And then I was like, wow, I didn't realize that was so sensitive. Or I think I had a chiropractor friend press on it and I was a little bit surprised at how tender that is. So a lot of times you can have pain in an area and not realize it until you touch it and press and kind of dig in there a little bit, lightly, gently, okay? I'm not telling you to dig into your clavicle and your ribs, folks, okay? But you could feel the bony misalignment. He could feel it. He even brought it to my attention. And my guess is when he was doing dips or when he fell when he was a teenager, that may have caused this rib misalignment, and then doing dips kind of put him over the edge. Either way, it doesn't matter what caused it. I mean, yes, that can help us diagnose whether it's costochondritis or a rib problem, but in this situation, I did some tests and I'm gonna be able to show you guys right now. So go ahead, turn over on your back. So first we're gonna check his clavicle, and then we're gonna check the ribs. And there's just a few tests that we do in extremities for certified extremities practitioners will know how to do this. You're gonna keep a fist, you're gonna punch all the way up into the air, and then you're gonna come back halfway. So punch forward, Yep, and then come back halfway. Yep, and I'm gonna push down, resist me. 1, 2, 3, resist. Any pain? Okay, and we're gonna do that again. Punch forward, come back halfway, and resist. Okay, and relax. It was a little bit spongy there, meaning a little weak, okay? Not awful, but go ahead and punch forward, come back halfway and resist. Okay, and we're gonna do that again. Punch forward, come back halfway and resist. Okay, also there, any pain on either of them? Okay, so some people have really high thresholds for pain. Derek here does, I can tell. He didn't have the pain until I poked around in that right spot in the inferior medial portion of his clavicle and sternoclavicular joint, and then just specific points at the rib head. So there was a little bit of weakness on both sides, a little bit worse on the left side. Now we're going to do a couple of other tests, so arms straight out. So now I'm just checking for a couple of other things in the shoulder girdle, like an anterior humerus, and I'm gonna push down on 3, and I want you to resist me. 1, 2, 3. So that hurt?
Yeah.
This arm?
Yeah.
Yeah. So the anterior humerus is definitely an issue here. And he also said something to me that stood out, and I'm gonna go over that in just a second. And you guys may be suffering from the same symptoms, so we'll talk about that in a second. So he had the rib test was weak. The anterior humerus, where the humerus has come out of the glenohumeral joint anteriorly, much more common, 90%, 10% cases are posterior. And the clavicle out of position, we're gonna just double check that. Yep, keep your arms straight, and 1, 2, 3, resist. Any pain? 1, 2, 3, resist. See how his whole body rocks, right, like that? So it's not showing up too weak, but I can tell. Relax that shoulder there. Clavicle's out. So we have to adjust his shoulder joint, his clavicle, and his rib, just from all the tests that I've done and found weakness and or pain, okay? And then he does not have a case of costochondritis. He has a slipped rib. And one of the reasons I know is he told me that he has pain. And if you guys have pain when you reach across, right? Or you reach down and out like that, right? Do you have pain when you reach down and out? Yep. So, or something's heavy, right? Because when his rib is pushed out and forward over his sternum a little bit. So when he reaches over more, it just makes that, it makes that misalignment more pronounced. And it takes him to the point of pain, which is what drove him here from Bermuda. We're in New York City. It's not that far. If you've never been to Bermuda, check that island out. It's beautiful. Okay, we're gonna start by adjusting your back. Okay, because I may mess, I don't want to throw anything out of alignment with the shoulder. I'll do that last. So go ahead and turn over on your stomach. Okay, take a deep breath in and blow out. Sorry, you folks that you can't see this, but I have to do it from this side. Okay, and relax here. Okay, turn over on your back and slide down. Slide down, there we go, good. Cross your arms in front of you. So this is the adjustment. That's why I want to do your shoulder last. Give yourself a big hug, tuck your chin down. Take a deep breath in, come on up, half a sit-up, or a quarter of a sit-up. Yep, and blow all the way out. Okay. All right, now slide up, all the way up, so your head is up to the top of the headpiece here. A little bit more. A little more, another 2 inches, another inch, a little more. Right there, good. So what I'm doing is I'm getting his top ribs and clavicle up over this headpiece because it's a drop piece. You guys don't have this at home, okay? Don't try this at home. Yeah, I was just telling him I taught my wife to do it to me, but it's me teaching her. It's, you know, it's a different thing than you teaching your wife or your partner to do this, or your husband, whatever, to do this to you, right? So do not do this at home. Go see a professional to have this done and assessed properly, right? First, you need the assessment. You need to know which direction, right? It's not that simple, okay? All right. So we have some tension knobs here. I'm able to adjust the tension here and turn your face to the left. Look straight. How about when you take a deep breath in? Does it make it worse? No, just reaching over. Okay. Deep breath in. And blow out. Turn your face to the left. And head in the center. So I adjusted his T2, T3, T4, T1, T2, T3, T4, those 4 top ribs and the clavicle, both in the back and the front, okay? Now, we're gonna check your neck. Any neck problems, neck tension, tightness, headaches? Any numbness or tingling in your hands or fingers?
Maybe, I don't know.
Which hand, do you notice?
No, it's not
Okay.
obvious.
So that last adjustment might cause, you know, tension headaches, sinus problems. The first adjustment down here that I did would cause numbness or tingling in your hands or fingers. You could see on that poster there, the nerves in our neck control the muscles and the sensation in our shoulders all the way down to our arms, fingers, down to the fingertips. So that's why I had asked that question. Now, I'm gonna have you come on up and we're gonna test it. I'm gonna have you lean forward, you know, reach forward and, yep. So spin your legs around to this side. And the test for you was reaching forward. That aggravated it. So let's go ahead and have you gently do that with your left arm. How's that feel? Same, better, worse?
Like minimal in terms of noticing.
Minimal?
Minimal, yeah.
Okay. And usually when you reach across like that, how bad is it?
I would feel it. I would definitely feel it.
Okay. Here's what I want you to do. Don't do that. Don't force that. I just want you to test it once there. Try not to do that during the day, reach above your head or anything like that. I'm going to give you some stretches that I want you to start doing in the pec muscle. So we'll talk about that. And if you guys are expecting to see some stretches, no, because I don't know your particular case, but we do have a lot of videos on costochondritis stretches, so make sure you watch those. He does not have costochondritis. He has a slipped rib. Thanks for tuning in, and a shoulder problem. And we're gonna finish up adjusting his shoulder. You guys wanna see it? What do you think? Should we show him the rest of it? Okay, sit right here on this cushion. All right, so we adjusted his clavicle and his ribs in the back and in the front. Now we had to adjust that glenohumeral joint, that anterior dislocation. I've done videos on this too. You guys can check those out, but let's go ahead and adjust his shoulder here. That was the one where I had him put his hands out like Superman, and I pushed down, and he kind of made a comment like, ow, that hurt him, and his arms kind of blew out pretty weak. So we're gonna go ahead and correct that. Relax here. Just relax here, relax there, yep. Okay, now, you can lay on your back or stand and do the same test. Go ahead and lay on your back. And we'll test it again. Arms out. Okay, and on 3, 1, 2, 3, resist. And I did not push lighter, did I? You okay?
Yeah. I didn't feel
He's got a weird look on his face because he's surprised that it feels better. Anterior subluxation of the glenohumeral joint is so common. You have to have that checked out if you have or think you have costochondritis. I can't stress that enough. Whoa. So you're all set. Go ahead and sit up. Thanks for tuning in, guys. I appreciate you. And if you got anything out of this video, please subscribe. We've got 4 new videos coming out every week. And hit that like button, comment if you will. And I do try to answer your questions. So thank you again. Appreciate you all. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.